my name is Dr. Jagram-Payer. I work in the ER at Lakes Regional Healthcare. And with the soaring temperatures of summer and everyone trying to get out to enjoy the great weather and the warm weather, we thought we should talk about heat-related illnesses and how to prevent it. So your body usually sweats on its own and cools itself down that way. However, with the increasing temperature and humidity, that sometimes is a little harder to do. So there are some tips that you can do to help cool yourself down. One of the things is drink more fluids regardless of your activity level, don't wait to be thirsty. Avoiding caffeinated beverages as well as alcohol will also help, especially if you're anticipating going out in the warm weather for long periods of time. Water is always your best option. However, you can use sports drinks, which will replace any minerals and electrolytes that may have been lost. Stay indoors as much as possible, especially in the air condition. If you don't live in a home that has an air condition or you're camping outside, even a few hours of being in an air-conditioned environment will help. You can use public libraries. You can use even the restaurant at Lakes Regional Healthcare for a few hours to cool down. Shopping malls as well is a good option. If you are outside and want to cool down, you can use handheld battery-operated fans as well as misters. Those work really well as well. Clothing, lightweight, light-colored, as well as loose-fitting clothing. Wide-brimmed hat is also recommended. And don't forget your sunglasses and your sunscreen, of course. And lastly, just limit unnecessary activity, especially outdoors. If you need to be outdoors, try to do mornings or evenings as they tend to be a little bit cooler. If you work in the outdoors, you're a professional athlete, or even exercising in the outdoors, prior to your activity, make sure you drink at least 2 to 3 bottles of water or glasses of water to try to hydrate even before you get out into that environment. Also, a recommendation is frequent timeouts as well as water breaks. Getting into a shady environment just for a few minutes may also help cool you down. So prevention is always better. However, noting the signs and symptoms of heat-related illnesses can be life-saving for you and a family member, and just identifying them. So mild to moderate sweating, always a good thing. Excessive sweating, you're robbing your body of those electrolytes and it hinders your circulation and also can hinder your brain function as well. There are different variations as far as symptoms. You can have simply heat cramps where you have leg cramping as well as just kind of involuntary muscle twitching that can happen. Try to put some cool compresses on the muscles, hydrate, water, sports drinks. Those should help. If you have more severe symptoms of dizziness, nausea, a headache, flushing, even cooling clammy skin, you can actually be headed towards heat exhaustion, and then you need to move yourself into a more air-conditioned environment. Hydrate as well, and you can use cool compresses to the face, the forehead, the neck, the axilla area, and the groin area to try to cool yourself down. Now, the most dangerous one is when it gets into heat stroke. Some of these signs and symptoms could be disorientation, could be confusion as well. The skin will feel very hot and dry, an increased heart rate, as well as just like if you have a fever, just really hot temperature. Those types of symptoms, you need to call 911 or get to medical care immediately. And while waiting for emergency services to arrive, there's certain things that you can do. You can wrap yourself or your loved one in a wet sheet or towels. You can put them in a cool bath until emergency services arise. So basically, the point here is just making sure that you stay in a cool environment, you stay hydrated, and here at Lakes Regional, we just ask you to have a happy, safe, and healthy summer here at the Lakes.